Dr. Cass, you have been a proponent for a number of areas of natural health for the 10 years that I've known you. You attend conferences on a very regular basis, and you also do a lot of work trying to educate and educating your peers. How do you go about that, and what kind of response do you get?
Well, first of all, in terms of sharing my information with other physicians, my books. I try to make the books actually even understandable to doctors. Mm-hmm. The educated public and physicians who don't take a lot of time to read books, they're likelier to read a journal article. So I do it through my books, through my writings, and also when I'm talking to a physician whose patient I'm seeing, if we have a patient in common, I make it a point to call that physician and let them know what I'm doing. My colleagues may not be that familiar with the supplements that I'm giving to people or the lab tests that I'm doing, but I make it a point to speak to them and explain it all to them. And some of them are quite receptive to say, how do you learn about this? Where did you learn? I'd like to learn more. I get that from some of them, and some of them say, I'm not really interested. So there's really a whole cross-section of people. When I speak at medical meetings, I generally get a really good response. At least the ones that are interested come up afterwards and ask me questions and want to know more, want to learn more. And that's really encouraging to me. I mean, part of my goal is really to educate physicians in all of this natural medicine, or what we call functional medicine.
Well, I don't want to embarrass you, but you're probably one of the 5 most well-respected individuals in your field relative to achieving that goal. It's something that is sorely needed. It's something that will save healthcare, save a lot of people. But if there aren't more people that come out and actually start to educate their peers and be able to show them the results, I think once this whole glut hits of the baby boomers, we're going to be in serious trouble.
Yeah. You're right. We need to change medicine, and medicine has to change from the inside. And it looks like it's really starting as a grassroots movement among the population. They're demanding it. And I'm saying demand this from your doctor. Bring your doctor my books. Bring them, supplement your prescription. If you're given a prescription, say, what about nutrient depletion? What about, do I have to take certain supplements? I read that you need to take certain supplements with this drug. What do you know about that? And if they don't know, give them the book and talk to your pharmacist. We need to educate the pharmacist. Well, the pharmacists are actually pretty savvy. We need to educate the physicians. And they don't have a lot of time, so whatever you can spoon feed them, whatever you can give them that's already prepared, great.